The commercial determinants are key, and we actually have the perfect person to build on that narrative. Ashka Naik, the Director of Research and Policy at Corporate Accountability, who works at the highest levels to challenge the abuses of transnational corporations. So welcome, Ashka.
Thank you so much, Susan, for invitation to this pretty stellar forum. So my message today cuts across a few themes already presented on. And as you just mentioned, complements what the previous speakers just shared. Childhood obesity and food industries accountability, and why this is a matter of justice. But let me just kind of take a step back and begin by saying that I do not know of a social justice leader, may it be Mandela, Gandhi, or women leaders from social movements from La Via Campesina or Chipko movements in the Himalayas, who have not put the health and well-being of future generations at the center of their life's work. Nor has there been an indigenous or ancient society that has not prioritized how children can thrive and flourish as generations pass by. And it was successful. And because of that, we are here today. However, in the modern mechanistic organization of socioeconomic hegemonies, we have done a massive disservice to this foundational principle our ancestors once embraced. For example, a recent poll by Wall Street Journal and the University of Chicago has found that a large majority, nearly 80% of Americans believe that their children's lives will be worse off than theirs. According to UNICEF, 180 million children living in 37 countries are more likely to live in extreme poverty, be out of school, or be killed by violent death than children living in those exact countries 20 years ago. According to the FAO, a child dies every 10 seconds from malnutrition. So while conflicts, and we can't not mention the plight of the children of Gaza today, economic shocks and extreme weather conditions are drastically exacerbating world hunger, there is an enormous burden of non-communicable diseases now exhausting children and youth across the world, as Erica and the previous speaker shared. Nearly 40 million preschool children under the age of 5 are found to be overweight or obese, a 60% increase just since 1990. And of these 40 million, 35 million live in the global south. The worldwide prevalence of obesity has nearly tripled in the past 3 decades, disproportionately affecting children and youth from socioeconomically excluded populations. Now, all this did not happen in vacuum. Obesity and other entities did not increase because humans suddenly started selecting unhealthy foods or they were not smart enough to fathom ill effects of these products. Of course, the industry, the likes of Coca-Cola, PepsiCo, Nestle, McDonald's, their supply chain actors, fueling this public health crisis and extreme destruction of agroecological biodiversity, would love for us to put the blame on individuals. But in fact, there is a long history of colonization, corporatization, co-optation of local indigenous food systems by a very few global North-centric elite business interests that have now displaced or fully destroyed local vibrant food cultures with their industrial commodities sold as foods, resulting in this explosion of diseases. As the previous speakers mentioned, there are deep racial dimensions to this. And just to add to what Erica shared, a recent report by the Rudd Center for Food Policy and Health has found that 19 big US food corporations allocated upwards of $1 billion of their ad budgets to Black and Hispanic consumers in 2021, pushing hyper-palatable, high-calorie, low-nutrition products like candies and fast food. So that kind of makes sense, right? Why we see these disparate numbers in the findings of the research that was shared. On the other hand, there are other forces at play. Evidence-based science that added sugars cause NCDs, that certain chemicals are nefarious if used as food additives, and so on, is systematically challenged by industry-backed junk science, specifically designed to deny, delay, distract, and deflect the blame away from their products. Food industry argues that their food is cheap and accessible, and thus must be considered essential service. In fact, we saw that across countries in the COVID-19 pandemic, food industries lobbying governments. Well, these products are cheap because industry's political influence has ensured that billions of dollars in government subsidies are directed to commodity crops like soya, like sugarcane sugarcane and corn, the primary ingredients of many of these ultra-processed foods. And so then the real cost of these products is borne by public health systems and by our children and youth as burden of diet-related diseases. And now, big pharma, specifically the weight loss drug companies, are leveraging this crisis of childhood obesity for profit by funding institutions like the American Academy of Pediatrics, which then goes on to publish guidelines that recommend that weight loss drugs and such pharmacological solutions can be used for school-age children. The conflict of interest embedded here are just remarkable and mostly opaque. So what can be done? Well, actually a lot, and a lot is being done. We and innumerable community and civil society organizations across the world are working closely with frontline communities, policymakers, multilateral and government institutions to cultivate solutions for requisite kind of transformational change. And to seriously address this public health catastrophe, we have been and must continue to demand that public resources are put behind advancing strong, conflict-free science, that we immediately safeguard nutrition and public policies from influence of the industry, and we must embrace strong regulatory infrastructure to ensure that industry becomes accountable to the people and that the well-being of future generation is not left at the feet of the industry's caprices and corruption. And this is precisely why childhood obesity is an urgent ethical and a political issue, an issue of democracy, and an issue of justice. Thank you.